Menopause, transition, the change. It doesn't matter what you call it, it can be overwhelming for both women and men. Once diagnosed, there are treatments that not only work, but contrary to long-held belief, are also safe. Menopause was a similar, unavoidable and unfunny journey of discovery for comedian Jean Kitson. Overwhelming hot flushes, anxiety, aching feet and mood swings. What do you think of the way menopause is described? The menopause, the change. It sounds horrifying.
The change. That just sounds like the end. It's all over. You know, that's the end of her. Say goodbye to your mother now. We won't be seeing her again.
On average, the so-called change of life hits us around 50. But the symptoms of perimenopause can appear 5 to 10 years before then. And that can mean a lot of confusion and anguish. For as Dr. Kelly Teagle knows, many women are blindsided by severe symptoms. How bad can it get?
I have women who come to me in tears saying that they think they're going mad. That's a really common one.
Why do you think there seems to be such a gap in our knowledge about ourselves at this time of life?
I think that it's very much perceived as being the downward spiral, you know, that it's all around ageing and that they're not going to be up to the job. So I think, unfortunately, it has a lot of negative connotations that lead women to feel shame and deny what's happening to them.
The stereotype of a menopausal woman is that she's snappy and angry and bitchy and all that. But I don't think that's really true. A lot of women lose their confidence, they feel more anxious and anger. And they might snap, but it comes out of a feeling of like what's going on.
No wonder women feel lost and lonely, especially with a medical world largely silent on what to do about this universal stage of life. What was your experience when you went to get medical help, assuming you went to get medical help?
Well, my first experience was just going to the chemist. So I went to the chemist and I said, look, I don't know what's happening to me. I'm getting really hot at night. I'm sleepless. You know, I've got bags under my eyes the size of cabin luggage. And this is the truth. This is what really started me on my what the hell is going on? Why is there so much secrecy? She glanced furtively around the shop and then she looked at me and she mouthed the words, hot flushes. Mouthed them, didn't even whisper them. She mouthed the words hot flushes as if it was something to be ashamed of.
Did you get a better reception from the doctor than the pharmacy?
Yes. Well, yes, I did, because then I went to a female doctor who was going through menopause herself and she just said, here, have what I'm having.
And it wasn't a joint, was it?
No, it wasn't a joint.
In the world of menopause treatment, HRT has been considered a dirty word, with a study from 20 years ago linking it to a frightening increased risk of breast cancer. And so almost overnight, women and doctors abandoned the therapy. But with nothing as effective to replace it, women have pretty much been left on their own ever since to suffer through menopause. As it turns out, for most, that suffering has been completely unnecessary.
If they have debilitating symptoms that are really impacting their ability to function, you know, it's just devastating to see them putting up with that when you know that there's something safe and effective that could be so helpful to them.
For the past 20 years, we've believed the shock headlines told the story of just how unsafe HRT is. But that study, linking HRT to breast cancer, has since been discredited as flawed. It's rarely talked about, but the truth is, while HRT may not be for all women, depending on their health, it can help most. Recent studies have found it doesn't lead to significant increase in breast cancer in women aged 50 to 59 or in women who start treatment within 10 years of menopause. And according to Dr. Kelly Teagle, there are other health benefits to also consider.
For example, we know that it helps to protect against the development of cardiovascular disease. It also keeps bones strong. We know that women actually die less often from COVID, and also it may be preventing Alzheimer's and things like that is being heavily researched. Morning, how you going, Cassandra? I'll be just a minute.
Herself a GP, Dr. Teagle is well versed in all sorts of health challenges from all ages. But it wasn't until she was 42, when she started experiencing early onset menopause, that she understood the vacuum of knowledge for many doctors around something every woman will go through. How would you describe that time of your life?
It was a bit of a red hot mess.
As a GP, did you know what was going on?
I should have. I wish I'd realised earlier, I think. But, you know, like many women, my life at midlife was very complex. So, you know, I probably didn't twig as early as I should have. Sort of struggling with symptoms.
Shocked by her own oversight, Dr. Teagle established WellFem, a telehealth service to reach Australian women anywhere. When you consider the number of women who don't know about their options, would you say that women have been let down?
I think this is an endemic problem that relates to menopause and menopausal women being largely invisible. So I think this ties back in with why it's been largely ignored by medicine.
As a politician, I'm on a mission to make us all menopause warriors. We started the revolution and it can only get better from here on in.
It is a worldwide failure, one that British MP Carolyn Harris is committed to fixing.
This is 500 A4 pages of comments that would absolutely break your heart. It is an absolute national disgrace what is in here.
To help her suffering constituents, Carolyn Harris has lodged a private members' bill in the British Parliament, which, if passed in October, will make HRT available for free to women in England.
October the 29th.
So that seemed to me to be the one that would make the biggest difference in the short term to women. But now people are saying, oh, let's talk about this a bit more. Let's find out what else is going on here.
Are you finding that people want to listen?
Yeah, the response to me starting to talk about it has been absolutely phenomenal. But there has been some quite emotional responses that have been given. I remember one debate when the minister responding was a man. When he was younger, he remembers his mother being taken away to an asylum.
My mother was 50 years old.
But they then found out she had menopause. And that was really emotional for me.
She was carted out of the house and she ended up in what can only be described as a Victorian asylum.
Oh, right near the lady reading the book too.
It's a revolution Jean Kitson is right behind. Her own shock experience of menopause was tempered by HRT, and she's made it to the other side, also known as post-menopausal.
That was a bouncy one.
But she was so appalled by the taboo of talking about menopause, she wrote a book about it.
It's really important that women know that we're not diminished by menopause. Once we have the right treatment for menopause, we are strengthened by menopause. We are more in control of our own lives. We can focus on us. It's a really great time of life. It's a very empowering time of life. You know, it's a time when we just don't take shit anymore.
As we know, women go through menopause as they age. But did you know men actually have a similar period of their life called andropause? Insider Dr. Danielle Martinez says this could be the reason you're feeling down.
Testosterone is the male hormone, which it's commonly known as the male hormone, but women also produce testosterone. Your ovaries and your adrenal glands will also produce testosterone. Women need to have a certain level. But it is the hormone that provides men with their secondary sex characteristics. It gives them the energy that they usually are used to, the sex drive. It helps with their sexual function. It also helps them just mentate normally. So men with low testosterone sometimes will feel blah. They feel a little bit, they just don't feel normal. They feel almost
say like
a little
lethargic lethargic and
not only lethargic, but they don't feel like they normally would. A lot of them will come in and say, I just don't feel right.
Well, does that happen because as you age, that level goes down?
As we age, the level does go down. We don't have a very good grip as to what specifically your testosterone level should be depending on the age. We just have a normal range, which is 250 to 850. But we do know that as men get older, they can develop what we call andropause or menopause.
Right, which, by the way, it's something I had no idea, because as women, we eventually go through menopause. But men also go through, as you said, andropause, which is like their form of menopause.
Correct. The major difference is women, they hit a wall. Men, this is a slow decline over time. Certain things can accelerate this, but a lot of the symptoms are very similar. You can have the lack of focus, the low energy, the muscle loss,
the night
decreased
sweats,
motivation, the night sweats, absolutely. Insomnia, weight gain, bone loss, mood swings, depression. A lot of what we see with the female version of dropping of their hormone, their major hormone, the estrogens, we will see also in men as they begin to develop andropause or menopause.
And now, as sometimes in women, they go through early menopause. Do you often see a lot of young men go through andropause as well?
Yes, we do, unfortunately. And I don't know why. I think it may have to do with a lot of the lifestyle choices that we're making nowadays, the American diet, not exercising enough, the high stresses, the drug use, the other medical problems that we're developing from not exercising, doing all these other things as well. And so, yes, of course, we can develop. Now, what is premature? We don't quite understand that either. We know that we tend to see hypogonadism or low testosterone issues somewhere starting around 50s, 60s. But I've seen it as young as men in their teenage years and 20s.
Wow. Okay, so we talk about, when we have our women's health shows, we talk about hormone replacement therapy for women. Is the same available for men?
Yes, it is. It is available, and it is very useful and great in certain patient populations that truly need it. That's the key word here, is if somebody really needs it. If your thyroid stops producing thyroid hormone, you need to replace your thyroid hormone.
So why is this one controversial?
Because I think a lot of people are being prescribed testosterone that probably did not need to be put on testosterone. They're not really counseled appropriately, and they don't quite understand something as simple as, hey, by the way, this is for life. When a patient comes to me and says, oh, I took it for 3 months and I felt better, but now I feel terrible, I say, well, yeah, because it's meant to be taken for life. And so I think better education and better awareness as to what's the right way of taking these medications and who really should be on it and what are the risk factors if you're on it has to be implemented.